Hey everyone, and welcome. Today, we have a truly fascinating explainer lined up for you, centering on what I like to call a real clinical medical mystery. We're going to be talking about refractory fever, those incredibly stubborn fevers that just absolutely refuse to break no matter what you seem to do. It's a super stressful situation for any parent, and frankly, a really frustrating challenge for medical professionals in outpatient settings too. But what if the issue isn't the medicine at all? What if it's the internal environment of the body itself? Today, we are going to unlock the pathophysiology behind all of this and learn how to actually manage it safely. Let's get into it.
Okay, let's dive right into this. Here is the frustrating paradox that so many of us have faced. A patient's temperature spikes way up, over 38.5 degrees Celsius. You give them the standard fever-reducing medicine and crickets. Literally nothing happens. The fever just stays high. Now, it is so easy to assume the medicine is just a bad batch or the dosage is wrong, right? But more often than not, it has absolutely nothing to do with the quality of the drug. We really need to stop asking what's wrong with the pill and start asking what is physically blocking that pill from doing its job inside the body's hemodynamic and electrolyte systems.
To solve this mystery, here's our roadmap for today's explainer. First, why the fever won't drop. Second, the hidden dangers of injections. Then, we'll walk through Step 1, fluids and electrolytes. Step 2, pink and white fever. And finally, Steps 3 and 4, safe alternative methods.
All right, Section 1. Why won't the fever drop? Let's uncover the biological roadblocks causing NSAIDs to fail and investigate the crime scene inside the body. We really need to understand the mechanics of what happens right after you swallow that pill. When you take NSAIDs, things like paracetamol or ibuprofen, they work by sending a very specific message to your brain's temperature control center, the hypothalamus. They basically block specific enzymes and chemicals, like COX and PGE-2, effectively telling the body, hey, release some heat by sweating and dilating blood vessels. But here is the catch. For the body to actually execute this command, it absolutely requires adequate blood volume and a perfect balance of electrolytes. If those conditions aren't met, the brain hears the message, sure, but the body physically cannot comply.
And this brilliantly illustrates the three true culprits behind why the medicine fails. First up, hypovolemia, or low fluid volume. During a fever, the patient breathes really rapidly. That's called tachypnea, and they lose massive amounts of fluid right through the skin and lungs. The blood literally thickens up like syrup. Second is the inability to sweat. If your fluid is low, the brain actually stops the sweating process entirely just to maintain your blood pressure. It's in survival mode. And third, potassium deficiency. The sheer stress of a fever flushes potassium out of the cells and out through the urine. Why does that matter? Because without potassium, the smooth muscle tone in your blood vessels is destroyed, completely blocking the release of trapped heat.
So moving on to Section 2, the hidden dangers of injections. We're going to talk about the dangerous myth of the intramuscular lytic mixture.
Listen, now that we know why the pills fail, we have to look at how people usually react. In a lot of clinics, when a fever won't break and panic sets in, the immediate reflex is to give an injection, a lysolytic mixture, usually a combo of Analgin, Dimodrol, and Novocaine, right into the muscle. Now, I know this is a super common practice, but physiologically speaking, it is a highly dangerous mistake. It completely, 100% ignores the actual condition of the body's tissues during a high fever.
Let's walk step by step through why this is a total recipe for disaster. During a high fever, the body centralizes its blood flow to protect vital organs like the heart and brain. This means the blood vessels in the skin and muscles go into a severe spasm. They are effectively bloodless. So think about it. If you inject medicine into that tight, spastic muscle, it doesn't absorb. It just sits there, creating this depot effect, or an infiltrate. Best case, it does nothing. Worst case, you risk sterile abscesses or tissue necrosis. But wait, the real terror happens later. When the patient eventually warms up and that spasm finally breaks, that entire, massive, pooled dose of medicine suddenly floods into the bloodstream all at once. This triggers a sudden, terrifying collapse, a critical drop in body temperature below 35 degrees Celsius, and a dangerous crash in blood pressure. We are basically creating a delayed time bomb in the patient's muscle.
Clearly, we can't rely on injections. So let's move to Section 3. Step 1. Fluids and electrolytes. This is the foundation of our safe, modern algorithm.
Before you even think about giving another dose of NSAIDs, or at the very least at the exact same time, you absolutely must rehydrate the patient. This is non-negotiable, folks. You are setting the physiological stage for the medicine to actually work. Ideally, you want to use specialized solutions like Regidron or BioGaia. But hey, if you don't have those handy, simple salt and sugar water works absolute wonders, as do potassium-rich dried fruit compotes. Remember how we said potassium was vital for blood vessel tone? This is how you replenish it.
So the crucial point here, and a lot of people miss this, is the temperature of the liquid. You must provide these fluids right at body temperature, specifically around 37 to 38 degrees Celsius. Why? Because fluids at this exact temperature bypass the stomach's holding phase entirely. They are absorbed almost instantly into the bloodstream. It's essentially hot wiring the system, the fastest possible way to restore blood volume and give the brain the green light to start sweating.
Once fluids are on board, we jump to Section 4, Step 2. Differentiating between pink and white fever to relieve spasms.
Okay, you have to play detective here for a second. Every doctor and parent needs to memorize this matrix. We have to visually assess if it's pink fever or white fever. With pink fever, the hemodynamics are actually good. The skin is pink, it's warm, it's moist. The body's heat production and release are balanced because the blood vessels are wide open. First aid, super simple, fluids and NSAIDs. But white fever is an entirely different beast. The patient is pale, they're shivering, covered in goosebumps, and their hands and feet feel like ice. This is a massive red flag indicating severe peripheral vasospasm. All that dangerous heat is trapped deep inside the core. If you just give NSAIDs here, they flat out won't work. You have to give a spasmolytic first, something like Drotavarin, you might know it as Noshpa, or Papaverin to physically pry open those vessels. Only then can the NSAIDs do their job.
And this distinction leads us to a massive rule regarding physical cooling. For pink fever, physical cooling, like warm wiping or compresses, is absolutely allowed and totally helpful. But for white fever, physical cooling is strictly forbidden. I repeat, forbidden. Think about it. If you apply cool water to pale, shivering skin that is already in severe spasm, you will violently worsen that spasm. You are essentially slamming the door shut on any heat trying to escape.
All right, let's wrap up this algorithm. Section 5, Steps 3 and 4. We're talking alternative routes and safe physiological cooling.
Now, what's really interesting about this is our anatomical workarounds when standard pills just aren't cutting it. Since we know we're avoiding intramuscular injections, what do? Well, rectal suppositories are amazing. They drain directly into the systemic circulation via the inferior vena cava. This means they completely bypass the liver for absorption speeds that are almost as fast as an IV. Just obviously don't use them if the patient has diarrhea. Another great alternative, oral suspensions or powders. They absorb way faster than solid pills. And here's a pro tip. If the patient is nauseous or vomiting, don't force a full dose down at once. Give it in tiny sips, literally just one small swallow every 5 to 10 minutes.
Finally, Step 4, safe physiological physical cooling. Now remember, do this only for pink fever or after a white fever spasm has been completely resolved. You want to gently wipe the areas where the main blood vessels pass close to the skin, so the neck, armpits, and groin. Use warm water that is strictly just 1 to 2 degrees below their current body temperature. Absolutely no cold water. And I need to be crystal clear about this last point. Sponging the patient with alcohol or vinegar, I know it's an old folk remedy, but it is strictly prohibited. The skin's permeability is sky high during a fever, meaning it absorbs those substances incredibly fast, leading to rapid, severe systemic intoxication. Just don't do it.
So we're left with this really profound question. Whenever you're facing down a stubborn, scary fever, ask yourself, are we just treating the thermometer, or are we treating the body's internal environment? As we've seen throughout this explainer today, blindly forcing a number down with aggressive injections or ignoring hydration completely misses the mark. True healing and safe symptom management comes from understanding the body's intricate physiopathology. If you restore the fluids, balance those electrolytes, and break the spasms, the body will finally allow that fever to break naturally. Thanks so much for joining me on this deep dive. I really hope you walk away feeling empowered with this crucial knowledge.